Okay.
All right. Good evening. This is Mary Sue with Michigan Parkinson Foundation. Thanks for joining us this evening. I think we have a great program. We have Dr. Barbara Pickut, who is with the Department of Neurology at Michigan State University. She is a movement disorder specialist, and she has been doing research on mindfulness exercises in managing Parkinson's symptoms. She is going to talk about her research and the exercises, and at the end of the program, we're going to do some practice. So now I give you Dr. Pickut. Thank you so much for being with us tonight. Also, folks, I'm going to mute everybody. If you need to ask a question, please keep them to the end of the evening, and we'll ask questions at the end of the night. Let me mute. Dr. Pickut, when I mute everyone, you're going to have to unmute yourself. Can you do that? Do you see where it is?
I'm currently unmuted.
When I mute everyone, it also mute you as well. And then you have to unmute yourself, okay? I'm going to do it now.
So, can you hear me?
Yep, we can hear you. Great. Thank you.
Very good. Very good.
We've got 30 on the call right now. They just keep popping up.
All right. That's wonderful.
Yeah, we can get started.
All right. So you like me to start, or you want to wait a minute
or
so?
No, I would get started. We've had quite a few for a while.
Okay, super. So hello, everyone. Thank you very much for taking the time to listen to what we have to say about mindfulness and people with Parkinson's. It's an honor and a privilege to be able to speak with you about this evening. So thanks for being here. I think I have about 30 slides, something in that order of magnitude. We'll leave some time to introduce some practices and also some time for questions, and we should be ending right around 8 o'clock. So mindfulness, it's a word that has become part of our vocabulary for many of us. And the definition actually comes from a Pali word. The Pali word is sati, and it has a loose definition meaning awareness, attention, and remembering. And in a looser definition, sometimes we speak about even, remembering, pointing towards rehabilitation. So re-inhabiting the body. So why would we be interested in talking about, learning about mindfulness with Parkinson's? Well, the observation is that from a clinician's point of view, things that I've heard that people tell me and things that I've observed is that under stress, there may be a worsening of motor symptoms such as tremor, freezing, dyskinesias, and also non-motor symptoms such as anxiety, pain, difficulty sleeping, a number of them, and we can talk about those. And we'll touch on this again in a few moments. And the other reason is that people with Parkinson's are seeking to obtain a state of wellness, a state of being and identifying not strictly with having Parkinson's, but also enjoying ease of well-being in life. So where does mindfulness situate itself within the realm of medicine? So it actually came about first to be accepted in the group of complementary and alternative medicine practices. And these are mind-body therapies, groups of therapies where yoga and meditation finds itself. And the focus here is on the relationships between the brain, the mind, behavior, and the effect that the brain, mind, and behavior have on health and disease. what we know about the use of complementary and alternative medicine, we see that people with chronic conditions in general tend to reach out or follow CAM, or complementary and alternative medicine practices. And people with neurologic conditions in particular are represented in higher numbers when you look at the study of who is following complementary and alternative medicine. And mindfulness has actually grown broader than the field of CAM. So when we look into integrative medicine and what is integrative medicine reaffirms the importance between the practitioner and the patient. And interesting for us is that the focus is on the whole person, more congruent with the definition of the World Health Organization, that it's not as much or only disease, but also the state of wellness, looking for that stance in life where there is some well-being. And integrative medicine also emphasizes scientific evidence and emphasizes the appropriate therapeutic approach to achieve optimal health and healing. So these are the places where in our world, if you go look it up, mindfulness, you'll find that it's referenced in both integrative medicine and complementary and alternative forms of medicine. So starting to think about, we have this observation that when we have Parkinson's, the symptoms may be aggravated under stress. So that's one thing that got us thinking about, well, how could we address that? Because as we know, many non-motor symptoms in Parkinson's are difficult to address with the current therapies. So looking into the literature, we see that mindfulness has been applied in people with depression. It has been applied in people who have chronic pain. Also studies, and these are the dates, like depression was first studied with mindfulness in the year 2000. Anxiety has been investigated using mindfulness as a tool or an intervention or a treatment. And a very important study in 2010 by Grossman was published in Neurology, which is one of the top journals in our field, looking at mindfulness training in people with multiple sclerosis and an impact on their quality of life. So why do I show this slide? Because we know that these elements, for example, depression, anxiety, and chronic pain, are issues that we have when we have Parkinson's. So we wanted to look at, well, mindfulness has been studied already in these areas. How might that apply to people with Parkinson's if we offer mindfulness training? So what is mindfulness training? So we know that mindfulness itself means a certain awareness that we cultivate. Mindfulness as an entity, if we can call it that way, was conceptualized by Jon Kabat-Zinn, and he formed a mindfulness-based stress reduction clinic. And this was done at the University of Massachusetts in 1979. And what he did was to bring three techniques together. He was a meditator, and a good friend of his was a yoga teacher, and they put together a program for people with chronic conditions at UMass. These were generally folks who, where the treating physician didn't know what to do with them, and sent them to this stress reduction clinic. And herein, people learned how to cope with various chronic conditions. There was focus in the beginning on people with pain, but also irritable bowel syndrome, and cancer patients were well represented in this group, in these groups in Boston at the time. So how Kabat-Zinn defined mindfulness for the purposes of the MBSR clinic back in 1990 was a development of awareness. And key here also is present moment experience. Like, what are we experiencing right now? How and not just thinking, but also feeling. And not just emotion, but also what are we feeling in the body? How is the air temperature? What is the quality of the voice that's speaking to you now? Things of that nature. And to view these things with a non-judgmental stance. So to create some room between experience and awareness, and then building on that, action or reaction. So later on, he refined this definition, speaking about an awareness that emerges through paying attention on purpose. So often we go through our life on autopilot, and when people are learning mindfulness, there is an emphasis that is brought towards paying attention on purpose. And what we discover when we pay attention on purpose, and what we discover about this unfolding of experience from moment to moment. Key in that idea, of course, is not carrying over experience, but seeing what the experience is that's actually unfolding, not one that's fabricated out of thought. So what I just explained is a little bit complicated, but this mindfulness training is a process. We'll get into how long and what the process looks like, but I don't want to scare you off already. We have time to develop this over weeks that we meet together. So there is what we call a perceptual shift, how you perceive, how you perceive reality, what that does to you, and how you react to that. And it's perceiving the thoughts that we have, the feelings that we have, and internal stimuli, like when we have Parkinson's, feeling the tremor, feeling the stiffness, feeling pain, or feeling emotion. And to begin to recognize these things as events that are occurring in a broader field of awareness. So it's an idea, again, of bringing room, bringing space, becoming spacious around these things that grab us. So mindfulness is a training. It's a training that we partake in to affect a change in our brain chemistry, and as we'll see in a bit, possibly our brain structure, most likely. And it's a training that in the MBSR world, so the mindfulness-based stress reduction, is an 8-week training group meetings that last about 2.5 hours. And in the 6th week, there's an all-day session. And that lasts, depending on the teacher, that can last a half a day, that can last 6-7 hours, that people are actually physically together. Now, this is also occurring online. So these meetings have morphed into our time period now to face what we're all facing. So this is possible to follow online. Within the training, so what do you do for 8 weeks? What do you do these 2.5 hours for 8 weeks long? Well, there's formal training in mindfulness meditation, formal training in mindfulness yoga. So I'm aware that some of us on this Zoom meeting tonight have been following yoga at the Michigan Parkinson Foundation, thanks to Mindy Eisenberg and others. And that's a wonderful endeavor. So mindfulness yoga is also part of mindfulness training. It's one of the 3 pillars. And in addition, there's something called body scan, which is sort of a Jules Verne exploration through the body, through the feelings that we have in the body. In a typical mindfulness-based stress reduction program, there will be homework where people are asked to practice 45 minutes a day. We say 6 out of 7 days a week. And what does one practice? Well, the yoga, the mindfulness yoga, or a body scan or meditation. And generally people are provided audio CDs or recordings so that they can follow these on their own at home at the time that suits them best. We also talk about an informal training in mindfulness, and that is the practice of mindfulness during everyday daily activities. For example, one of the first things that people talk about is washing the dishes. For those of us who don't always use a dishwasher or do the pots and pans, just the feel of the warm, soapy water, the bubbles bursting, or the feeling of the suds in between the hands, coming back into connection with those feelings and not missing the pleasant things that there are in life. So this is a very busy slide, and I wanted to show you this because there was some talk in 2005 here, the first study that's mentioned, Sarah Lazar at Mass General published an article of work that they did looking at long-term meditators, a group of them, and they took these meditators, and they also took another group of in the same community, age-matched, sex-matched, education-matched individuals, and they looked at these two groups using MRI. And what they found is people who were long-term meditators, that they actually had increased brain volume compared with the people who were non-meditators, who were just as educated, same socioeconomic class, and same sex. So this study actually hit the cover of Time magazine at the time, talking about, meditation makes your brain grow. I guess that's a way to popularize it. But in fact, it seems to be true. And all these studies that follow up on this have shown that through meditating, the brain can change. Well, that's interesting, but we're all not going to sit for 8, 10, 12 hours a day meditating. We are in a different type of society generally, and we can't do that. So the question becomes, what is the dose of meditation, yoga, that promotes brain changes, positive brain changes? So a very important article came out in 2010, Britta Hülsel in Gießen in Germany looked at a group of people who followed mindfulness-based stress reduction training, and again compared these people with education-matched, sex-matched, age-matched control people, and looked at them under the MRI. And she found that after 8 weeks of training already, there was a change in the brain where there was more volume in the brain, and not just in the whole brain, but in certain areas of the brain that we know to be important in thinking, feeling, and moving. So we, a few years later, asked the question, well, could that be the case then also in people who have Parkinson's, where we know there are changes in the brain? Can people with Parkinson's also have changes in the brain in the same order of magnitude as the worried well, as we call them, as people who don't have Parkinson's, who are seeking stress reduction? That's the question. So this larger research that has been conducted since the early 2000s, actually much earlier using EEG technology, and in the early 2000s then using MRI, for example. These were all on long-term meditators in the beginning. And you see here a growth of studies looking at mindfulness. So how is mindfulness impacting health? These are not just imaging studies. These are numbers of studies that you find in the scientific literature looking at looking at mindfulness and its impact on health. Sorry, my arrow is, my arrow, there's my arrow, thank you. So this is a study we did, published in 2013. We offered mindfulness to people with Parkinson's, and we used a paradigm, as we call it, in our world, with a wait list control, which has its problems, and I'm happy to talk about that if anyone's interested in it. So we had a group of people, and we used a protocol for this study that was congruent with most drug studies, with most drugs that are coming into market. We use the same sort of criteria for people to include in the study and people to exclude in the study. We looked at 30 people, which for an imaging study is a reasonable amount. 15 of them followed the intervention and 15 were in usual care. These 15 then were offered to follow the study after these people were analyzed. And what we found was that there was an increase in gray matter density on MRI brain. So what does that mean? That means an increase in volume, in density actually, of the gray matter. And what is the gray matter? The gray matter are the actual neurons or the cortex of the brain. And there was a change over time between baseline and after 8 weeks of mindfulness training. So as we saw in the early work, in the early imaging work, the brain, when it is exercised, and this doesn't just have to be with mindfulness. I mean, we had early studies also of taxi drivers in London before there was GPS. And you could see that the hippocampi in these taxi drivers enlarged with their increased knowledge of the street map. It's also been shown in medical students who were cramming for exams. So we know that parts of the brain are very responsive to learning and changing. The areas that we listed here that we found with people with Parkinson's who'd followed mindfulness are important because, you know, some of them have to do with depression and fear and memory, and also sensory, the temporoparietal junction. So relevant areas to people with Parkinson's. This is some of the raw data. It's a little clunky slide, but just to show you, these are the kinds of things we analyze. And these yellow dots are the changes over time. So these are the changes of the people who'd actually followed the mindfulness training. We also showed that the group that didn't follow the mindfulness training, and this is very interesting, people that didn't follow the mindfulness training had a change in their cerebellum compared with the group that had the training. So, you know, our cerebellum is the part of the brain. Let me take the next slide for you. Cerebellum is this part of the brain. So it's the small brain. This is the large part of the brain, and the small brain in the back. Helps us with a number of functions, including motor, large function of motor, but also cognition and probably other things that we don't yet understand. And the right cerebellum communicates with the left hemisphere, and the left hemicerebellum communicates with the right hemisphere. And there seems to be some compensatory action. So we found that the people who followed mindfulness training perhaps had less pull on their compensation that was required from the cerebellum. So this was an unexpected results that came out of the study. So you can say, good, brain volume has changed. What does that do to my life? How does that impact how people are feeling? So we looked at the neurobehavioral effects of mindfulness on people with Parkinson's, and we saw that over the 8 weeks time, that these people who participated had an improvement in the UPDRS motor 3. What is that? That is that thing that your neurologist likely puts you through, the finger tapping, the fist open and close, the hand turning, the foot stomping. Those are all things that we measure in the clinic. Well, we found that the people who were in the study, participated in the study, actually improved in their motor function significantly, statistically significantly. We found that there was a change in the scoring on the Parkinson's disease quality of life, 39, item pain. So we found that people became more aware of their pain in the study. So it's kind of a negative finding, yes and no. And that is a whole discussion. We also found that people who participated in the study increased in their ability to observe. So the FFMQ is the 5-facet mindfulness questionnaire, and in their different aspects of mindfulness are investigated, one of them being observe. And in our group of participants in this particular study, we found an increase in the observe facet. So in these studies, we have indications that there's possible trait-like changes, so changes in the nervous system that flow out over time and are measurable after a certain amount of time. So not just changes when one is meditating or one is doing yoga or body scan, but there are changes measurable outside of actually doing the work. And it's postulated that these neural networks that we found in this study may play a role in PD and may be amenable to some change secondary to meditation. The behavioral changes in motor and non-motor symptoms that we saw were published peer-reviewed journals, but I would say we still have work to do in terms of what aspects of mindfulness training might be the most efficacious, and we'll get to that in a moment. So yeah, just pointing to that further studies are needed to examine these effects. And there are issues, of course, with study paradigm, what the rating that's done, that there's adequate blinding, that the raters who rate the people who participate in the study, the raters who do the UPDRS, for example, that they're blinded. We had that in our study. And that also there's an adequate control group, and that I would do some self-criticism that we didn't have an active control because there was not one accepted at that time. And I think in terms of research, we're getting to the point where we have control groups for studies that we think are valid and have been validated, so that if you're going into a clinical study, this is the equivalent of getting a placebo. So what can we offer those folks who aren't getting the mindfulness so they're not sad or disappointed that they're not one of the ones in the active group? Because maybe if they're sad and disappointed, they're going to score worse. So we want to offer these people also something, and that is what I'm referring to when I talk about an adequate control group or an acceptable control group. So along comes a very interesting article published in 2019 by Kwok et al. And her group took 138 people with Parkinson's. This was not an imaging study. They looked at, she had two groups, and this is going to touch again to this control group idea. One group of 71 subjects followed the Mindfulness Yoga, and the other group was allocated to an intervention of stretching and training resistance exercises. So more, if you will, a typical physical therapy protocol. So they compared these two groups of people over time. And what was found by Kwok and her group is that the mindfulness PD group scored superior over the stretching resistance training exercise group for managing anxiety and depressive symptoms. And the effect sizes here were moderate to large. So there was clear benefit in anxiety and depressive symptom management in the mindfulness yoga Parkinson group. Also in the Mindfulness Yoga Parkinson group, there was a significant improvement in psycho-spiritual aspects of life. And Kwok writes that that confirms the mindfulness component of the intervention. Okay, so that brings us half an hour into the talk, so I will talk a little bit less now in that way. And I'd like to offer an introduction to these three pillars of mindfulness briefly, and then we'll have some time for question. Let me see, let me take the video back. So I would just ask if you are, if you want to participate, that's wonderful. If you don't want to participate, just to be respectful of people who are participating. Otherwise, it's a little bit voyeuristic if you're not participating and just sort of, you know, looking at people. I'm enlarging my screen so I can see you all. I hope you will agree to this in terms of, you know, either participating or not participating, and just being respectful of the other people you see. So let's jump right into it. If you all are sitting, and if you're sitting in a chair, then if it's comfortable for you, if it feels safe for you, then just you can choose either close your eyes or set your gaze beyond the computer screen. Like let's take a break from the computer screen and just gaze out over what it is in front of you, not focusing on anything in particular, but just taking a moment to let yourself settle in. And again, you can choose eyes open, eyes closed. Some people prefer one or the other, which is also a whole discussion, which we won't go into now. So just sitting here, let me give you a taste of what's called the body scan. So I'd like you to bring your attention to your feet. Without moving your feet, bring your attention to your feet. Many of us as adults have no feeling in our feet any longer, do not feel them without moving them. So having said that, maybe a number of us have moved them, and that's fine too. But the point would be to just go into the feet. So appreciate your feet from the heel, where the large bone, the calcaneus is, large bone. And then you get sort of a fanning out of bones in your feet going toward your toes. And see if you can actually mentally go in there, go into your feet and follow the line out toward the toes. Maybe some of you are feeling the temperature of the room. Maybe some of you are feeling this feeling of socks or a blanket over your feet. And maybe some people are not feeling anything at all. So just take a moment, I'll be quiet for a moment, and just examine your feet from inside and moving toward the outside to the skin. And then I'll start to bring your attention up your calves. And pause for a moment and appreciate how the calf is built. It's actually quite remarkable. So you've got the hard, bony side that we have banged up over the years, right? Banging into things. And then you have the fleshy underside of your calves. So if you can for a moment, go in there and appreciate those two compartments, if you will, those two areas. It's not just a lower leg, but a very, marvelous, actually, piece of architecture, structure. And it might not always be a pleasant experience if we're having cramping. But how is it now? How is it in this moment? What is there to feel in the calves? So let's take a moment and we'll jump to our hands. So however your hands are placed, place them comfortably and just see, again, sort of analogous to the feet. Examine in your mind how your hands are. Where are they in space in this moment? And just making note of the fact that you know how they are in space without even moving them, right? And all the information that you can glean now in terms of temperature of your hands, in terms of what they're touching. So just explore for yourself for a moment that. The hands. And then bring your attention to, if you will, moving into your forearms. And perhaps some of you have examined it as a whole, or maybe, again, thinking about the bony structure in your forearms and the meaty part. Maybe becoming aware of those compartments and even wondering what's in between. Some of us might even feel pulsation moving from the forearms to the hands, or not. Some of us might be feeling discomfort. Or tremor. So it's this unfolding of awareness that we pass by, particularly as we get older. I mean, think of a baby laying on its back and sucking on its toes. We don't do that anymore, right? I guess most of us don't anyway. That unfolding of awareness, that being able to look at something so simple as your hands and your feet and your lower legs and your forearms, gives you a wealth of information that we rarely register. So I'd like to invite you to take a deep breath and we'll come back together. And that was an abbreviated version of a body scan. Generally in mindfulness training, we do a body scan of 45 minutes. It's surprising that it can go by so quickly when you're doing it. It's surprising that while doing it, some people fall asleep. And some people use this technique actually for difficulty sleeping. So it's very relaxing to be aware of the body. And it's also a manner of addressing pain in many instances. So let's see. Let's do a few yoga poses, if that's good for you. And we'll do it sitting. We'll stay safe sitting. And so if you all would become aware of how you're sitting in this moment. And if you're sitting in a chair with a back to it, I'd like you to lean back into the chair. Just lean back slowly into the chair, feeling your vertebra or your spine, one by one, pushing back into the chair. And generally speaking, our head is the last thing to follow. If you don't have a headrest, that's okay. Just go to the point where you're not uncomfortable, but apply gentle pressure to your back on that chair. Maybe you can feel your shoulder blades touching the chair. So bring attention there. And please notice what your breath is doing in this moment. See if by allowing your body to push backwards, to use your back muscles, you automatically open up somewhat in the chest and through the shoulders, without stretching, without forcing. Just the idea of opening up and freeing up the belly. Let the belly be loose. Let the belly be soft, like, you know, those rubber balls that we used to play in gym class, those rubber balls that kicked so deliciously that really bounded away when you kicked them, that sort of quality. Let your belly expand. Let your belly not relax, but expand as you're pushing backwards. Now, if it's good for you, if you would like, we'll move with the arms. And as you do this, you might choose to close your eyes, but I would like you to consider that moving your arms, you're moving them through a medium. You know, if we were in water, I could convince you much easier that we're moving our arms in a medium. But here now, when we're raising our arms, we are also moving our arms through a gas. And when you move your arms up and down, just feel how that feels to be moving through air. Just very aware of those hands that you just examined, aware of those forearms that you just examined, how that feels to reach up and down. Become aware again of your back. Make sure that we haven't folded in on ourselves, but we're opening up through the chest, opening up through the belly area. Okay. And I'd like to invite you now, if you will, to reach out in your screen. If you can see each other, if you can see yourself, I'd like you to reach as if you were reaching for the person's hand next to you. So I'm reaching my hand out here, and I'm reaching my hand out here, and see if we can all online reach out to each other here in this group. I see some people who aren't reached to, so I'll reach to you all. But in this way, we're a community practicing mindfulness. So I'll leave you all with that, and I will give the floor back to Mary Sue to help us with question and answer. And thank you all for listening. Now I'm listening to you.
Thank you, Dr. Pickut. That was excellent. Folks, I think we have a big crowd on this. We've got 44 people, so I think it would be easiest if you asked your questions through the chat. There is an icon that says chat. On my screen, it's at the bottom of the screen. Could you type your questions in the chat, and then I will make sure Dr. Pickut sees them?
Mary Sue, what do I have to do to get them?
If you want to click on chat, it should show up if anyone's asking a question.
Yeah, it's interesting. I'm not able to.
You're not seeing it?
Oh, I have to probably exit my talk.
Well, here, I'll make you not be the
Host, just make me host away.
Exit, go ahead. And then I'll make you I'll stop the spotlight video. Okay.
Make me a participant.
Is there
Yay.
a mindfulness training online available?
Yes, there's a lot out there. There's a lot out there. We are looking into, we have been looking into this for some time. Actually, I just completed a training at Brown University for mindfulness online. I would stay tuned to the Michigan Parkinson Foundation or the Parkinson's Association of West Michigan. Upcoming, I think we might make some announcements. There are many mindfulness training for people, not specifically for people with Parkinson's, I'll put it that way. There's a lot out there. Training for people with Parkinson's it's few and far between. But again, you can ask the Michigan Parkinson Foundation soon about perhaps some upcoming plans. It would be interesting to know how many people are interested in following this. So if you're interested, let Mary Sue, is that okay that I?
Yeah, I would say if there's enough folks that are interested in participating in training, what I'm hearing you say is we put one together. Is that correct, Dr. Pickut?
Perhaps.
Perhaps, okay. We are, just so that you all know, we are doing yoga Wednesdays and Friday mornings at 10 a.m. and Monday evenings at 6 p.m. So we are offering yoga 3 days a week, and it's an hour-long program. In fact, I think our yoga instructor might be on this call. Mindy, if you're on the call, can you let me know that? She told me she was going to, yeah, I don't really see her. But anyway, so we are doing yoga. We are looking at perhaps doing mindfulness training in the future. We don't have anything planned yet, but we will definitely let you know.
And can, if someone's interested, is there a way to have a mailing list or something, Mary Sue? Or we could put something out and
Yes.
invite people in November. Okay,
Yes.
That's fine. Okay.
How long should your daily practice be to achieve improved brain function?
That is a very, very good question. So I can only tell you what's been studied. Probably somewhere between a half an hour and 45 minutes. So since the start of this mindfulness training, there's one thing called Mindfulness-Based Stress Reduction, MBSR, pardon me, and that's what was conceptualized by Kabat-Zinn back at University of Massachusetts in '79. And there have since been many iterations of that, and we call those mindfulness-based interventions. So some people started teaching a 3-week class or a 10-week class, and shortened meditations and longer meditations. And there's a whole lot, as I said in response to the question, there's a lot out there, but that hasn't all been studied, right? So my bias is to look to see what does the literature suggest. And so I think that we could safely say a half an hour to 45 minutes. Does that need to be every day? That's an interesting question. I think that not all brains are alike, and that some brains are more amenable to this kind of training. So it depends on a number of factors, but I would say a half an hour, 45 minutes. If you look at the literature around transcendental meditation, which is a whole nother thing, they start people out with 15, 20 minutes a day. So, but for mindfulness in general, I think the literature is pointing to 30 to 45 minutes. But you can do mindful moments throughout the day. So add those up. Like when as I said, when something very simple, I guess the classical thing is, to stop and smell the roses. We don't do that. And, it's become almost a throwaway phrase, stop and smell the roses. But to actually stop and actually smell the roses, right? Or actually stop and feel the quality of your computer, feel the warmth of the keyboard, feel how it is to take a shower, feel just those everyday activities in life, to be aware of your thoughts when you're doing it. Often, I don't know about you all, but you can be taking a shower in the morning, and by the time you've gotten out, you've already lived through half your day in your thoughts. And what's going to happen, and then this is going to happen, and I'm going to say this, and when they say that, I'm going to do that. I mean, we are often so busy in our brains that we bypass the simple pleasures in life and the pain in life. And we may suppress or augment thoughts. And so that in a long-winded answer to your question, add those moments up. Add those moments up. That is reinforcing a way of thinking that, in my mind, could be counted toward those 30 or 45 minutes. But of course, this isn't a business deal, right? So I hope that was helpful as an answer.
Okay, do we have any other questions? I'm not seeing anything in the chat. Oh, here comes one. Are there some exercises to do for small motor skills? I really have become deficient in, example, putting in peer steerings, putting on emphasis. Have there been studies? Also handwriting. So small motor skills. Anything with that?
That's a very good question. Yes, I'm sure they've been studied in the world of ergotherapy, right? Not as much as I know in mindfulness. I'm not aware of any studies specifically on fine motor skill. So I would say that that's my assessment right now. But I think that your physical therapy or your occupational therapy, particularly occupational therapy, is a good place to have that addressed. It's also a question of is it a tremor that's impeding? Is it the bradykinesia that's impeding? What is it just that's impeding? And that is a discussion to have with your healthcare provider who's guiding you in the Parkinson journey. A very important question, a very big question. The mindfulness aspect to that would be how that makes you feel, what feelings come up, how those hands feel when you're doing this. That's important. Not only, we're not talking about alienating yourself by identifying a movement, but it also helps you become more aware of your body, more aware of the effects of medication, and more aware of the effects of physical exercise, of yoga, of all these things. And that may aid you in some way to understand the the situation that you're describing. So I would say PT, OT in the first instance. And then mindfulness to be, to learn to be gentle with yourself, or to learn that self-talk, that criticism that we all have when we try to do something that doesn't work out. Often those initiate cascades of thoughts that make us feel worse, and maybe changing our internal chemistry by eliciting negative feelings. So if I wanted to ask you all a question, how was it? How was the mini voyage in the body, in your hands and in your feet? And how was it to open up and to push yourself back into the back of your chair? Anybody want to tell me how that was? Anybody who participated?
Let's see. Wait, I'm getting, somebody's writing that it was a really great experience. Someone else is writing, is the mindfulness yoga always done in silence, or is it ever done to music?
Let me address that. I want to be careful what words I use because I don't want to self-aggrandize. But I tend toward the not music, because you could, there's nothing wrong with it. Recognize that you're listening to music, I would say that. But life is so rich without music when you're doing yoga, mindfulness yoga, to be aware of your own breath, to hear your own breath, for example, is a study in and of itself. So I personally don't offer music when doing mindfulness yoga. There's nothing wrong with it. I guess it's a question of style and where you bring your attention. So not to bring your attention to the music, but to keep it on the body, which is the point of doing mindfulness yoga.
Here's some comments from somebody. I did get sleepy. Another comment is, I felt like I couldn't even feel my body. And someone else said, excellent, need some teaching here.
So interesting, when you fall asleep, what does that mean? That means you're tired, right? So nothing wrong with that. It's just pointing to something. Relaxing, to be able to fall asleep is a wonderful thing, right? So as I said, some people use the body scan to fall asleep. Put that tape on and it stops, and that helps with sleep because it makes us aware of how we're tensing during the day. We're often, parts of our body are tensed and we are not aware of it. So yes, good that you were sleepy. I hope you sleep well tonight, whoever that is. And what else was there, Mary Sue?
Well, I have a comment. I need this more than anybody. I have such a horrible, horrible habit of having to be multitasking with my stupid phone, and if I walk for an hour every night, having to listen to something on my, podcast or music while I'm out walking because I get bored. And I thought, when I take my walk tonight, I'm not going to listen to anything. I'm just going to walk and hope that this settles me down so I can sleep better at night. So
interesting. Yeah, there's so much to see when we're out walking. There's so much to see. And just watching ourselves in our mind. Oh, there I am again. I'm back at that meeting. Oh, there I am again. I'm thinking about what bill is due, or there I am again, backwards and forwards. And just to be able to be in nature or or in the city, whatever, but to experience where you are and not be somewhere else. I mean, we walk past our life, I do anyway, a lot. So, yeah.
Okay, do we have any other comments or questions? Okay, here's another one. In this teaching, have you ever used mantras? Be here now, for instance.
Very good question. You guys are getting really to the point of things here. Mindfulness does not use mantras. I mean, I think you can use the word one, and that's some of the work that Herbert Benson did at Harvard back in the day, using one as a, so, okay. I wanted to say something about New Age gurus, but I won't. So a mantra can be viewed as something holy, something given to you, something important to you, and I think that's wonderful. It can be given to you by someone, and those are what we call focused meditations, focusing on something given or something bought or whatever it may be. And then you have open meditation. So mindfulness training is, and there's literature about both of these things, right? There's not one good and one not good. Open meditation, what that is, because that's mindfulness, so I'll speak to that, is not concentrating on something, but opening up, creating room. So you'll be sitting meditating and you're not thinking about anything, but you'll see in a flash, you get thoughts, right? So one becomes aware that thoughts are being manufactured and are coming up like a screen on your brain screen, thoughts. So just becoming aware that that is a mechanism, that's what your mind does. Your mind is a thought machine. So mindfulness does not use mantras or objects to focus on, like a candle or some image, but is an open meditation where you observe the mind and what the mind does. Does that make sense?
Mm-hmm. Here's a really good observation. First, the pain in my arm and neck came to the surface. Then as I relaxed, the pain reduced.
That's interesting. That is an interesting thing that maybe that person wants to look at again. So if we were in a group, we would be in a group of probably not 40, because so mindfulness online would mean not just this person yakking at you, but this feedback that's starting now. We would be engaging with each other actively over the, however long it is, over the 2 hours. So there would be a smaller group. So we would feel safe talking now, because it's, these are now the questions are filtered through Mary Sue, and I'm grateful for that you're taking that. But just so you know, it wouldn't be such a large group. So everyone would be included and everyone would have room to speak up and participate.
Okay, we'll take one more question.
And thank you so much for the questions. I do appreciate it. I really do.
I'm not seeing any more. So Dr. Pickut, thank you so much. This was so helpful. To the rest of you on the call tonight, if we do some training, you're all in our database, otherwise you wouldn't have learned about this program tonight. So we will inform you. I know I send a lot of emails, but read them, because there are always updates on information on programs. And we've got yoga tomorrow morning at 10 a.m. So it'll be a nice follow-up to this evening, okay? So thank you, Dr. Pickut, for your time. I know you've had a long day and I really appreciate it. So good night, all.
It's my pleasure.
Thank
Goodbye,
you.
everybody. Thank you.
Thank you.
Thank you.
Okay, I'm going to end the meeting. Okay.